This is Trauma ICU Rounds, Episode 0. I'd like to thank you for joining us on Trauma ICU Rounds. I'm your host, Dr. Dennis Kim. I'm an associate professor of clinical surgery at the David Geffen School of Medicine at UCLA, and a trauma surgeon and the medical director of the Trauma Surgical ICU at Harbor UCLA Medical Center in South Los Angeles. I'd like to start off by saying that I am super excited to get the show off the ground. My mission is to provide you with concise and clinically relevant information that's immediately applicable at the bedside during the care of your critically ill and injured patients. Now, I debated whether or not to put out an episode 0 and ultimately decided to do so for a couple of reasons. First, the launch date for Trauma ICU Rounds has been moved up from the originally planned May 1st launch day. Given the current COVID pandemic and the pre-planned episode playlist, which begins with the ABCs of trauma and critical care management, it just seemed to make sense to get relevant and clinically applicable content out to both critical care and non-critical care providers who are on the front lines during the current global crisis. Second, I wanted to provide you, the listeners, with an inside look as to what we have planned for you on this podcast, or the W5H of Trauma ICU Rounds, aka the who, what, when, why, where, and how. So in terms of the why, I think there are two why questions that need to be answered. And the first why is, why am I launching this podcast? Well, like many of you, I've dedicated myself to the pursuit of knowledge and clinical excellence. And whether you're a medical student, nurse, NP, PA, or RCP, we all want to improve our confidence and knowledge base in order to provide the best, safest, and most compassionate care to our patients and their loved ones. But it's not always possible to stay current and up to speed on modern critical care, which is always in flux. Over the years, I've maintained a passion for medical education and want to share this with you, together with lessons learned along the way. That includes not just the success stories, but also the failures or mistakes, which, to be honest, are usually of more value and really stay with you. The second why relates to why should you listen? My hope is that by tuning in and interacting with both me and the content, you'll take away salient teaching points and lessons that can be directly applied at the bedside in the care of your patients. My mission, again, is to provide you with clear, concise, and pragmatic information that can help optimize your learning experience. I've already covered the who, so in terms of the what is Trauma ICU Rounds? There are several amazing and informative critical care podcasts out there, and I had to think quite a bit about what I could offer that's different or potentially complementary to the fantastic work being done by foam colleagues like Scott Weingart at MCRIT or Josh Farkas and my fellow Canadian Adam Thomas on the Internet Book of Critical Care. Ultimately, I think that as surgeons, we offer a really unique perspective and approach to the management of sick patients, and oftentimes we have to refer back to fundamental principles of anatomy, physiology, as well as pathology to work through diagnostic conundrums and ensure that we're providing the safest and most effective therapies, whether they be surgical or non-surgical, to our patients and their loved ones. In terms of the when and how, I am committed to releasing bi-weekly podcast episodes that'll vary in duration from 20 to 40 minutes in length. My goal is to regularly discuss and explore what I feel are high-yield topics across the spectrum of trauma, emergency general surgery, and of course, critical care. We'll also tackle issues related to professional development, as well as innovation in education, healthcare, and technology. Additionally, we're going to feature visiting professors as well as content experts who will join us on rounds to share their stories, experiences, as well as novel findings from recent clinical investigations. In between, there'll be a variety of multimedia content that will be made available on the website, that's traumaicurounds.com. This is going to include rapid rounds, journal club, blogs, vlogs, as well as surgical procedure videos. Regarding the where, you can subscribe and download from any of the major podcast directories, whether it be iTunes, Stitcher, Spotify, or Google Play. Once again, I want to thank you for listening. Please do subscribe to Trauma ICU Rounds wherever you normally download or subscribe to your favorite podcasts. And please be sure to tell your friends, classmates, and colleagues about the show as well. Also, again, do visit the website traumaicurounds.com for more information, news, and updates. And please stay safe, friends.